How about a hand for Diane? Zach Kohani is a pretty amazing guy. Most of you know him, so this introduction is just to add a few notes around the edges. Zach was born in Switzerland. His parents were legendary figures in something called the JDC, Joint Distribution Committee, which did miraculous things to save what small percentage of the Jewish population of Europe could be saved during 1940s. And Zach carries on that tradition of trying to make a really big difference in the world. I think you all know the story about the Department of Biomedical Informatics, but maybe not a few additional details. This was established in 2016 with Zach as its leader. He had previously been the developer and leader of a center for biomedical informatics based, as he was, at Children's Hospital here in Boston. The department had a curious beginning, and I had a small role in this because I was in the 2010 to 2018 period chair of the Overseers Visiting Committee for the Harvard Medical School. And in 2016, I believe, served on a special 3-person committee with 2 other experts in the field to advise on the elevation and expansion of the center into a basic science department here at the Harvard Quadrangle. We thought that was a pretty straightforward task with excellent people. Turned out it was a fraught time. Some departments were anxious because they didn't really understand what bioinformatics was all about. They went so far as to call us folks data clerks. And others were enthusiastic about it, but said first the dean had to make the medical school whole after the budget contraction of 2009. So it was a challenging item. Nevertheless, based on Zach's presentation and expansion of the presentation of, as recommended by our committee, Dean Jeff Flyer agreed to start the department. It was approved by the school, and within a few months it was launched. One of the remarkable initiatives of the department has been the 4CE. How many know what 4CE is? Not everybody. It's the Consortium for Clinical Characterization of the COVID-19 pandemic using electronic health records, GCCE. The emergency was declared on March 13, 2020. On April 1st, Zach sent a notice to the dozens of institutions known to have the I2B2 platform installed to invite voluntary participation, no grants to be written or received, in this 4CE. It was April 1st. By April 28th, we published initial findings on 28,000 patients, 36 hospitals in 6 countries. A major stream of papers about the waves of COVID infections in different population groups and affecting various organ systems followed. This June symposium has become a fixture on most of our calendars, starting with precision medicine, and that was a hot new theme, and into AI for healthcare, supplemented by the RAISE conference of 2023 and the September 25 upcoming conference on AI for healthcare. And of course, Zach's role as editor-in-chief of the New England Journal of Medicine AI journal has energized this entire field. He also, together with Kerry Goldberg and Peter Lee, published a very influential book on AI in healthcare, 2023, I think. Finally, I'm happy to mention that there is a lectureship here and a professorship which ties me to the department, and the current professorship is held by Maha Farhat, who is one of the terrific mid-career faculty here in HMS DBMI. Zach, the floor is yours.